In one of the most harrowing developments since the start of the Gaza war, hospitals are now facing total system collapse. On July 12, 2025, the World Health Organization warned that Gaza's neonatal wards are in imminent failure due to critical fuel shortages. At Al-Adha and Al-Shifa hospitals, only 1 or 2 incubators are still functioning in some wards, and doctors are reportedly making impossible choices to prioritize which infants receive oxygen. One pediatrician at Al-Shifa described the scene as like a disaster movie, with ventilators cutting out, monitors going dark, and surgeons operating by cell phone light. Although such conditions were first reported during the 2023 siege, they've resurfaced now in July 2025 with renewed intensity. At Nasser Hospital in Khan Yunis, staff say they are hours away from blackout, with emergency generators nearly drained. Doctors Without Borders has confirmed that multiple ICUs are down to manual bagging, and that patients, especially premature babies, are being transferred from collapsed facilities to those still barely operating. On July 10th, the UN coordinated a small fuel delivery of just 75,000 liters, enough to power major hospitals for barely 24 hours. It was the first authorized convoy in over 130 days. But with Gaza's hospitals needing roughly 600,000 liters per week, this gesture has been described by aid workers as symbolic but insufficient. Images circulating on social media of nurses hand-ventilating newborns have shocked global audiences. One photo of a nurse clutching a swaddled preemie under a flickering flashlight sparked the hashtags #FuelTheHospitals and #GazaChildren, which trended globally on X and TikTok. For the first time since the blockade began, even hardened emergency staff are admitting they've never seen anything like this. Gaza is a narrow coastal territory home to about 2.1 million people. Since Hamas's attack in October 2023, Israel has waged a relentless air and ground war in Gaza. That war came on top of an existing Israeli blockade that tightly controls all fuel and goods entering the territory. In practice, Gaza's power plants and ambulances are entirely dependent on diesel trucks permitted by Israel or Egypt. For months, fuel shipments dwindled to near zero. The United Nations now warns that fuel is the backbone of survival. In Gaza, it powers hospitals, water pumps, bakeries, and ambulances. Without adequate fuel, lifelines will vanish for the entire population. United agencies report Gaza is teetering on the edge of starvation, with food and medicine stockpiles already dangerously low. Even before these latest warnings, Gaza's health system was fragile. Over 2 years of conflict have damaged 94% of Gaza's hospitals, leaving only 19 partially operational out of 36. Generators sputter in the remaining clinics, and doctors ration any stored diesel. A recent UN relief convoy delivered the first official fuel in 130 days, but it covered less than 1 day's needs. Schools, water pumps, and sanitation trucks grind to a halt without fuel. Though Israeli officials say they work with the UN and allow some aid via alternative channels, Palestinians argue supplies remain tightly restricted. Gaza's people face a breakdown of basic services. Schools and businesses operate on generators by day, but nights turn deadly when lights fail. Hospitals, water treatment plants, and bakeries run only on delivered diesel. Without reliable power or running water, diseases spread in overcrowded shelters. In this prolonged siege, years of blockade and war have set the stage for disaster. Gaza civilians are densely trapped in a war zone with few resources of their own. When the fuel shortage in July 2025 hit hardest, it was not an isolated glitch. It was the latest chapter in Gaza's ongoing humanitarian crisis. The international outcry was swift. UN agencies and aid groups warned of catastrophe. The UN's Humanitarian Office declared the situation critical, decrying that hospitals were rationing, ambulances were stalling, and water systems were on the brink. Save the Children sounded the alarm that 44,000 Gaza children could soon be without clean water. The World Food Program warned famine was spreading and people were dying to find food. Doctors Without Borders and other charities urged immediate action. Around the world, activists held candlelight vigils and online campaigns demanding change. Hashtags like #GazaChildren and #FuelTheHospitals trended as images of crammed incubators flooded social media. Civil society groups and some politicians publicly urged Israel to open fuel corridors, calling the blockade a violation of international law. Even in parliaments abroad, representatives voiced alarm at Gaza's plight. Human rights organizations highlighted that cutting off fuel to civilians could breach the laws of war. Responses inside Gaza and Israel were deeply divided. Palestinian officials accused Israel of starving children and demanded fuel be allowed in as a humanitarian emergency. Gaza's health ministry publicly pleaded for fuel, warning any delay would be a death sentence. Israel's military, by contrast, insisted aid deliveries were taking place through approved channels and dismissed the crisis reports as a false narrative. An Israeli spokesman said trucks were entering Gaza and blamed Hamas for hoarding supplies. Gazans, meanwhile, shared desperate videos on social media. Midwives and mothers begging for minutes of fuel to save infants, humanizing the statistics and pushing this crisis onto the world stage. In the halls of diplomacy, alarm was also audible. Emergency meetings took place at the UN and in various capitals. Norway, Egypt, and others called for immediate humanitarian pauses. Aid agencies appealed urgently for funding, warning that without fuel, they would be forced to suspend operations. The tug-of-war over fuel access became a flashpoint of the conflict, highlighting deep political divisions. The searing images and stark debates made this one of the most talked-about stories on social media and in international news, with millions now watching to see if fuel will arrive in time to save those newborns. With the immediate crisis unfolding, eyes turn to what comes next. In Brussels, European leaders announced a new aid plan on July 10th. EU Foreign Policy Chief Kaja Kallas said Israel agreed to open more border crossings to allow larger deliveries of food, fuel, and medical supplies from Egypt and Jordan. The first shipment under this deal, a UN convoy carrying 75,000 liters of fuel, entered Gaza, the first in over 4 months, though officials noted it would only power the strip for hours. European officials pledged to repair vital infrastructure and reopen community bakeries across Gaza. Kallas said the plan would also reactivate bakeries and kitchens and repair damaged water and power lines, with monitoring to prevent any diversion. Israeli Foreign Minister Gideon Sa'ar confirmed the arrangement, noting it would bring more trucks, more crossings, and more routes for humanitarian relief. Aid groups had warned that Israel's military restrictions made deliveries nearly impossible, even after a partial easing of the blockade in May. At the same time, diplomatic efforts pressed on. Prime Minister Netanyahu, returning from Washington without a final ceasefire deal, reiterated that Israel was prepared to agree to a temporary pause if Hamas handed over hostages and disarmed. U.S. envoys and Qatar's mediators continued shuttle diplomacy to finalize details of a proposed 60-day truce. Aid agencies insisted that any ceasefire include guarantees of unfettered aid access. The World Food Program and UNICEF coordinated to mobilize immediate fuel and food deliveries to Gaza's hospitals if a lull materialized. On the ground, modest improvements could come if the new aid plan is fully implemented. Bakeries began producing fresh bread again, and hospitals could run more incubators and dialysis machines on generators for longer. Families might get water pumping back to their homes. Still, experts warned that these fixes are fragile without a broader peace. Israeli strikes continued across Gaza even after the aid deal was announced, killing more civilians and underscoring that the war had not halted. In short, short-term life-saving measures were being rolled out, but Gaza's long-term fate remained uncertain until a durable political solution could break the cycle of crisis. When the dust settles on this crisis, the larger lessons become clear. Gaza's hospital emergency is first and foremost a story of human suffering, of babies fighting to live and families struggling to protect them under impossible conditions. It powerfully illustrates that modern conflict impacts the most vulnerable in brutal ways, raising the painful question of why any society allows children's lives to hinge on a single delivery of fuel. On a wider level, this tragedy highlights the fragility of humanitarian lifelines during war. Gaza's ordeal, power running out in nurseries, clean water vanishing, bakeries idle, shows how quickly basic services can collapse. It prompts reflection on global responsibility. Cutting off fuel is effectively cutting off electricity, water, and aid for millions. International law forbids collective punishment, yet Gaza civilians have borne the brunt of this siege. This raises difficult questions. Will this crisis prompt a change in how civilians are protected, or will it become another forgotten chapter in the long history of conflict? Finally, Gaza's plight is a test of our collective conscience. We see candlelit incubators and grieving parents and must ask, will this moment spark lasting change? It demands more than words of sympathy. It requires action. Humanitarian experts say real relief means reopening corridors, rebuilding infrastructure, and pursuing a political solution that stops this cycle of suffering. Ultimately, the big-picture question is whether the world's outrage will translate into a future where Gaza's children can grow up in the light rather than the dark. If not, these tragic images will linger only as headlines, and Gaza's darkest hospitals will remain symbols of conflict that left a generation living in shadow.